welcome to the Alumni Talk as a part of the Voices of CS series at CS Academy Schools. As students, we often wonder what happens after school, how our seniors grow, choose careers, and find purpose beyond marks and exams. Voices of CS has been running to hear these stories directly from our alumni. Our guest today is Dr. Pratheshwar M, alumnus of CS Academy Erode, class of 2016. He is currently a junior resident in Preventive and Social Medicine at Kasturba Medical College, Manipal. We would like to take you back to your school years. Doctor, when you were a part of the very first batch of CS Academy back in 2009, when you look back now, who was Pratheshwar as a student, academically and otherwise? How do you feel you've grown along with the school over the years? And what school memories, friends, teachers, and classrooms are still close to your heart today?
Good evening, one and all present here. And as they have given a very brief and a very, uh, let's say, a very highly valued introduction for me. I'm Pratheshwar, and as they've said, I'm doing MD in PSM, which is Preventive and Social Medicine slash, or you can also call it Community Medicine in KMC Manipal. I completed my MBBS in Ramachandra Medical College, and yeah, looking back to my school years, I it's all it is a big splurge of nostalgia, the classrooms and everything. As we were the first batch of CS Academy, we grew up with the school, and there were a lot of milestones which coincided with what our school achieved and what we achieved as such, and. It brings back a lot of memories, the classrooms, the places we had to hung around, all the teachers that were very close to us, because from sixth grade we kept seeing them till the end of our the completion of our school. So it just is a big splurge of nostalgia. That's what I'd like to say.
Wow, that really helps us understand you as a person and as a student before the doctor you are today.
One of the most demanding careers. At what point did medicine become a serious career choice for you? How did you prepare for this path?
Yeah. Well, coming to choosing which to take medicine as a career, I know these are decisions that are being forcefully made by us for us at this point of stage. At 10th grade, we have to take a decision on which course or which stream to choose. Like if it's PCMB, it's physics, chemistry, math, and biology, or computer science along with it, or choosing statistics and there are a variety of choices that are available, and it comes to us at an age where we ourselves are confused about what we are supposed to be doing. The one thing that pushed me towards taking the PCMB stream is my curiosity as such, I'd say, and the scientific temper. Like in your life, we always come to a point in we always question a lot of things, how certain things work, how our body functions, how the environment works, how everything works. And when you have a lot of questions, your interest in science increases, and that's the only reason for me to choose that stream. And I was still confused between taking engineering or medicine for a long time, so I chose to pick both math and biology along with physics and chemistry. And slowly as such, my interest in medicine only came after I joined MBBS. Like till then, I was very confused. A lot of decisions were being made by people that were around me, by people that encouraged me to do it. And yeah, at the end of the day, I was very satisfied with where I've ended up.
That gives students a lot of clarity about career decisions and how they're not built overnight. And thank you
Mhm.
for sharing that.
Yeah,
Moving
sure.
on to question three. Many students feel the hardest part ends after they enter medical college, right? From your experience, how is the real journey of pursuing a medical degree over 5.5 years? The positives, the learning curve, the workload, and the challenges. How did this phase shape you as a person?
Well, MBBS journey was a very rigorous process. It's not a course where you just do for 3 years and you can move on to the next course. It's a prolonged 5.5 year course, and it's a long commitment. There were times when you question why would you even want to take something that's this strenuous and this long in this. But it all changes when you start working. It all changes when it all changes when the subjects that are there, everything that you're learning, and the way you shape people's life for in the future. Every instance, every little moment that you come across in your third year, you get to interact with patients regarding clinics, and even a small listening ear for a person that's having a long prolonged sickness, that in itself would help them, apart from the medicines and the treatment that they are undergoing. Those little satisfactions that you get throughout, it helps you push through. And there's also a lot of resilience and problem solving that are involved while you're doing medicine. It's like your Sherlock Holmes, and the problems that you're seeing are crimes that you need to solve in a body, and everything you nitpick and every clue that you find points you towards the right diagnosis, and that's how you treat the patient and help the patient in getting better. So it just was a very inquisitive and bigger commitment that really pushed me towards being resilient and continuing in the course that I prefer.
That honestly reframes medicine as a journey of resilience and lifelong learning.
Alongside this demanding journey, you performed well. During MBBS, you earned distinctions in several subjects while you were being active in sports, volunteering, and student leaderships. What was your approach to studying medicine, and how did you manage to balance academics with sports and services?
Yeah. When you get to a point in life where you are focusing on a particular stream and that stream is going to decide your career, there does come a lot of pressure that needs to be met. It comes with a lot of expectations that you have on yourself, and also people's expectations that they have on you. And if you shouldn't, as good as pressure is for you to push forward through in your career, beyond a point it kind of takes it a certain toll, and you need to vent it out somewhere, and you will always be interested in other things. It could be as something small as having a cup of coffee in the balcony and watching the sunset, or it could be something like a hobby that you would like to pursue. And it the key is, I'd say, a steady progress rather than a sit down and bulk reading of things. When you allot a certain time for everything, when you do study a certain amount every day, you will definitely have a lot of other time for your hobbies and sports and other activities. When I was in school, I was playing football. I was the goalkeeper for our school team, and I wanted to continue doing that. That little 2 3 hours of playing sports, it relaxed my body and mind in total. So that amount of exercise was also needed for me, as most of the work that I had to do in undergraduation was mostly a desk. You sit somewhere and you talk to patients, or you sit somewhere and you study. So that mobility was also there. So I joined the a college team, and I played for my college too, and that also inspired me to continue doing other activities along with hobbies along with that. I'd say the key is a balance of things, and not have extreme scheduling. Just a little step by step. Every day you study something and you keep it as such. So when the exams are approaching, or when you have to submit an assignment, you don't have a shit ton of work that you'll have to focus on. You'll have already been preparing for it for a long time. That will be my advice, I'd say.
That shows how consistency and discipline matters more than shortcuts.
One experience that deeply shaped the medical community was the COVID-19 pandemic. As medical students and young doctors, your batch experienced the COVID-19 pandemic very closely. Could you share how challenging and transformative that period was, and how you coped with the professional pressures of that time? How do you think it changed the medical and public health ecosystem overall?
Yeah. Uh, COVID-19 was something, it was a big surprise to the entire health community as such. And it was also a big surprise for public health professionals too. We've never seen a pandemic in play. We have read about pandemics in the past. We have read about other diseases that have been prevalent, endemic to a certain region, or as an epidemic that has spread out globally. But we have never looked at a pandemic at this sort of progressive level. And when it initially started, there were a lot of rumors and everything going on that it would out soon. But there were public health professionals warning the medical health system that this is not endemic or an epidemic, this is going to turn into a pandemic. It happened in 2019, is right when I was finishing my final year and going into internship. In MBBS, the first 4.5 years, you'll be focusing on various subjects and you'll be studying throughout and giving exams. And after the end of 4.5 years, you'll be doing a 1 year of internship. In that internship year, you'll be posted in different aspects of there are a different, like general medicine, surgery, ANT, ophthalm, the different branches that you can pursue further in the medical field. You'll be posted in it for a year. And when we enter internship, that is when you are intern doctors and you enter the main workforce. You are the closest relation that a patient can have. Like there are doctors, there are specialists and doctors, but a patient will not be able to directly talk to them. They'll first come to the first point of contact would be us. We'll have to counsel them, we'll have to take them to the specialty that's needed, and we were the bridge between the doctors and the patients. So when the pandemic hit, every hospital had to shut its other services down. All the elective procedures like surgeries were cut down, and we entirely focused on diagnosing COVID-19, finding out the tracing the contacts, finding out how it could have spread. And that was the my initial exposure to community medicine in a practical way, or a PSM in a practical way. Uh, we have read about how an outbreak investigation needs to be done if someone gets a disease and how it contacts. There are a lot of ways we have read about past investigations being done, but this time we were actively involved in it. We had questioned patients on their contacts, we traced them back, we called them up, we asked them to get tested, we isolated them, quarantine was set, and everything. It was a very fresh experience for us, and I'd say that played a very huge role in me opting for preventive and social medicine or community medicine as such.
Wow, that's really insightful. We are deeply grateful to healthcare professionals who worked long hours during that time and every day throughout their lives, often at great personal cost.
After MBBS, doctors do have many career paths to choose from. What opinion did you consider at that stage? And what did community medicine first stand out to you in a meaningful way? What did you see or experience that made you thinking about differently about healthcare?
Yeah, every aspect that you, every subject that you go through in MBBS, be it general medicine, surgery, ENT, or opthal, the who you treat and who you diagnose is a patient. That is it is an individual. But in community medicine, you look at the problem in a community level. You look at people. The people are there's not one single person is the patient. A village or a city or a country is the person, and you diagnose it and you treat it accordingly. You bring in interventions here and there forth. COVID-19 played a very big role in emphasizing the importance of public health, and that opened a new uh, door for me, I'd say. I did like interacting with patients. I still do interact with patients in my community medicine on a daily basis. We still do see patients, but at the same time, we look at problems on a community level. We look at, for example, if there's a cholera outbreak, we go and test water wells. We ask for water source, what type of water they have been using, and we find out what could be the reason for that particular disease being spread in the community. As such, this also is a kind of a detective work, but we are not focusing on the body, we're focusing among the people. And that was a reason for me, that's how I discovered community medicine as such. And after completing my MBBS, I worked. I did social work in a body that was associated with a political party as such. It was Academy of Marxist Studies. It was about it was a, I don't want to stress on the political party as such it's affiliated with, but they focus mainly on social work. They used to go to places where people are both economically and socially downtrodden, and we used to address their social and other economic issues. That is when I realized it's health is a it is a multi it has many factors that influence it. It's not just your other factors, it's also the social determinants of health. That's what we call it, the social determinants of health, like your occupation, the way the ventilation, your house you're staying in, the how much your monthly income is. Everything decides your health. Any disease that you contact through is going to be dependent on it. For example, India is a country where tuberculosis is very, very prevalent, and you may or may not have heard about tuberculosis or not have seen a person with tuberculosis. But at the same time, when you go to these places which are isolated, who are socially downtrodden and economically backward, and there is overcrowding and everything, Tuberculosis is one common disease that we see. When you see the coincidence of when you see diseases and the social structure coincide, you tend to realize that this problem is not just a health related problem. You can't just look at it as a one single doctor treating a patient. You can't just call them and say, you these are the medicines that need to be taken, these are the tests you have to do. You should also look at how affordable they are, how accessible the tests are, how accessible the medicines are. And that's where the government comes into play, the government programs come into play. And yeah, that was a big turning point for me to choose community medicine.
That sounds like a real shift from individual care to social impact.
Thank you for talking about preventive and social medicine. Um, could you please share how your MD journey was, how it differed from undergraduate medicine, and what skills, perspectives, and learnings this training gave you?
Yeah. While MBBS was solely focused on learning medicine as such, medicine and surgery as such, it focused on patients, it focused on diseases, it focused on how those diseases occur and how to diagnose it and how to treat it. MDPSM completely decentralized it. It moved from the patient to the community. My PSM journey, if you can sum it up, it would PSM, we can split it into two parts, like prevention and social medicine. The preventive part of preventive medicine is will focus on it's there is a saying that you have to prevent something before it even becomes a problem. It focuses on primordial, and the secondary preventions that can be done before a disease can even approach us. For let's say non-communicable diseases like diabetes, hypertension, and dyslipidemia, hypercholesterolemia, and other common non-communicable diseases which are not transferred by pathogens, which are the ultimate endpoint of our lifestyle choices. So we talk to the patients and the community on a bigger level to modify their lifestyles, have a certain routine, have a different way to look at things, and we also make sure that they are aware about when to get tested for these NCDs, and we conduct screening camps regularly so that disease are don't go undetected. And it was a lot of travel. That is one thing that you see in MDBS. You'll be organizing a lot of camps in different remote areas. You'll be going there, you'll be talking to people, and the other challenge of learning the language of where you are going also comes into play. When you have to connect to people in different communities, the main barrier would be language. Not everyone would be well versed in a particular language for us to directly converse with them. So was also a very challenging part. So in PSM, I am learning a lot as I am doing my course as such, but these are the challenges that I have faced. And there also is one more aspect of this, that is epidemiology. I have not touched it as such. Epidemiology is one of the core principles of community medicine. Here, in epidemiology, we look at data-driven decisions and other mainly analysis of that given particular data. We come to a hypothesis of what the data tells us, and we take steps and measures to control it. So it also involves a lot of statistics. And since I had taken math, and I was also interested in math in 12th, 11th, and 12th grade, it was a plus, I'd say. And there still is a lot of statistics and analysis, and you'll have to be updated with the softwares that I use to analyze the data. That's how you correlate the disease to the community. Like, you diagnosing a person is different from diagnosing the problems in a community. And every measure you take, every intervention you give out them, every medicine that's being rolled out, we just not look into how effective it is. We also look into how affordable it is, how much side effects that it would cause, and how beneficial, the risk benefit ratio that we look into. And everything comes down to numbers, and our decisions are data driven too. So that is also a key aspect, and those are the things I'm learning as such while doing this course.
Wow, that explanation really opens up a lesser known but extremely important field.
Many students are curious what career in public health actually looks like. After completing training in this field, what kind of work do public health professionals actually do? Could you please help us understand how national health policies, government schemes, and frontline healthcare management come together in this ecosystem?
Yeah. So I'd like to dissect into the different career opportunities that are available after you finish your MD community medicine. I'll there is a last resort that I'll touch. a bit later in this while explaining this. The first thing that you would do is you can focus on the preventive part. You can focus on completely going into preventive medicine. You can set up a clinic and you can talk about you will be allowed to, not allowed, you'll be focusing on diagnosing healthy individuals, finding out the unhidden diseases that they are coming up with, diagnose them, treat them, give them lifestyle choices and advices, focus on their nutrition and everything. The other different pathway is epidemiology. Epidemiology is data driven analysis and data driven conclusions that you draw that you can apply to the government, that you can apply to the public. And this can be done by working with the government and non-governmental organizations. With the government, there are a lot of the government rolls out a lot of national health policies and schemes, and by which health is accessible to everyone. In India, the private sector still plays a major role in healthcare, and we barely the government sector is only utilized by people that are not able to afford private healthcare. They have a notion that private healthcare uh, op- is a better health choice for them. And that has to be demystified. And that is still being demystified as more and more government centers are being opened. And every scheme is focusing on different issue as such. The NTEP, the National TB Elimination Program, has been focusing on reducing the number of tuberculosis cases in the community. As I'd say, we as a country are a developing nation and we have a lot of other issues that we have to focus on, including sanitation, including the improving the social well-being of a person, improving the economic inequalities that are there. And when these economic inequalities are lifted, we can see a betterment in diseases like TB and other communicable diseases that are prevalent in the society. And one more thing I'd like to talk about is working with non-governmental organizations. This can be NGOs that are separately focusing on a different issue, or it could be working. It could also be setting up your own NGO and spearheading it, focusing on the problems that are present in a small particular community and working for them towards it. The other major opportunity is working in international health bodies like World Health Organization (WHO) and International Monetary Fund. We have UNICEF, the United Nations Organization for Child and Children's Education. These are other organizations that focus mainly on WHO mainly focuses on health, where UNICEF focuses on child health. It also reproductive and child health. It focuses on uh, it funds a lot of programs in India. These organizations are the bridge between the developed and the developing nations. Funds from the developed nations are pooled into these bodies and they are directed into developing nations where these funds are needed for the betterment of the community. WHO also works closely and ties with the government. And when you work as a field officer, you start your work as a field officer in WHO, where you're posted to organize and various government health programs and analyze it and bring in the extra funds that are needed for different various programs. You act as a bridge between the international health body and the Indian government health body, and you bring those problems to them. That is also one way of opportunity. And the other would be, I'd say, is research. We also focus a lot on research and PSM. Scientific research is something that is not that is less touched upon. Every medicine that you take, every policy that is being made, every advice that's being given to you has been done after a long process of everything going through clinical trials and cross-sectional studies and cohort studies. Every medicine that's being rolled out has gone through a proper clinical trial procedure where it's being tested out first on animals, efficacy is notified, side effects are looked into, and human trials are started, and its potential benefit and risk is assessed and brought down to the community. As a public health professional, you can pick the population in which the study can be done. You can work into the epidemiology of it, and you can focus more on the research of it. In my MDPSM, I am focusing on TB and its national program utilization. Like there are national programs that are being present for TB, but there are very less people that are aware about it, not money or utilizing that particular program as such, and not many are gaining from it, the monetary benefits and benefits that the government is providing. So these are the things that you will focus on, and research is also that one field that you can focus on. And we as such are living in a society where scientific temper is decreasing. We focus on health advice and everything that are being churned out. We it's difficult for us to look at an Instagram reel and whatever health advice influencer is giving, or I say someone that's claiming to be a doctor is giving, and it's difficult for us to filter it out. So for that, we need an inquisitive knowledge and a scientific temper to increase. We as community health and public health professionals, we also focus on increasing the scientific temper of the people so that they can analyze and understand which are the right decisions that they have to take for their healthcare. And the last resort or the last option would be to join academia. You can join another medical college where you work as a community medicine professor, where you can guide other community medicine and public health professionals in choosing a career, and you can help and move along with them. You will still also be involved with research and other aspects of the thing. It's not a one way path that you are going to take. Whichever path you're going to take, there will always be aspects of community medicine in it. So these are the career opportunities that I'd say that are present in that you'll be having when you take MD community medicine.
That really helps students clearly connect policies, systems, and work on the ground.
Beyond careers and roles, values play a big part in medicine. Looking across your life, your family, school years at CS, college life, and professional journey, what values have consistently guided you? What gives you a sense of purpose of when working long hours and facing complex realities in public health and community work?
Yeah. That's an interesting question. Values as such, I'd say, my entire motivation for me to take medicine was like I wanted to feel, I wanted to be a bit, I wanted to help people, and that, I'd say humility, but that will be stretching it beyond the line. But when you are humble and when you are empathetic and you listen to people and you listen to those things and you come from a position where they can understand you, that is when you connect with the person, and that is when you can help the person out. And I'd say humility and empathy are the main reasons I chose this field. Along with that, you must also have a consistency towards studying and everything. And one thing I want to stress upon is, when I worked in the public for 2 years in social work, I looked at the inequalities that were present widely and how it intersected with the health and the other aspects of their life. The I'd say a purpose should lie in creating a system that uplifts those communities, make sure that everyone is viewed equally, and that is one important aspect that I want everyone in the world to develop. Uh, you want that equality among people. You want everyone to have the same access to healthcare. You want everyone to have the same type of medicines that that are available to them. You want you want that universal healthcare for everyone. So that is one thing that drives me towards continuing in this field, I'd say.
Your answer shows medicine is a valuable and value driven profession. Thank you so much for that response.
We are now open the floor for questions from the audience. Please feel free to unmute and engage or drop your questions in the chat.
Yeah, any questions are fine. You guys can ask questions. The host Saditi and Rishi, anything that comes to mind, anything that you want to know about, or anything that could be anything. It's
I have one question actually.
yeah.
In PSM, do you still treat patients individually? I mean, I know you consider the community most of the time, but do you still get to work with patients individually?
Yeah, that's a good question. I do consistently work with the patients every day. We are posted to different community health centers, which are hospitals that are not that doesn't have any specialties as such. And the people that are coming there, if they have an issue that can't be treated in that particular hospital, will be referred to a bigger hospital. There are different levels of hospital. The first level of primary healthcare would be a sub center, and then the primary health center, and then the community health center. Then we have taluk hospitals, and then district hospitals, and then we have uh, teaching hospitals where all specialties are available. So this is the hierarchy of colleges. In a sub-center, there are no doctors that are manning it. The only people that are available are senior nurses. They'll be the people that are diagnosing and sending the patients and referring to them to a higher center, which would be a primary healthcare. A primary healthcare will have a MO, which is a medical officer who would have completed MBBS and will be working with patients who they are able to treat. And in a CHC, we will also be posted there. We'll be seeing patients on a daily basis. We look at patients. There's a separate NCD clinic, like a non-communicable disease clinic, where patients with diabetes, hypertension, and other diseases come forward, and we have to prescribe them medications. We see them, we examine them, we find a diagnosis, we do blood tests. But the thing is, resources are limited in a community health center. You can't order every blood test that's available. You can't order every scan that's available. It's a I'd say PSM, seeing patients is even more challenging uh, than when you are in a bigger hospital, when you have access to different kind of blood tests and everything. You have to go back to your principles of medicine: proper general physical examination, understanding what the diagnosis could be. It's like a little archaic version of when these modern technologies were not available, how doctors had diagnosed patients. Like, we have those methods to do it. I'd say I still am in very much touch with seeing patients in my course.
So there's a question from Nakshatra. So
Yeah.
she asked, which college did you go to and how did you write the NEET exam?
Yeah, I did my undergraduation in Sri Ramachandra Medical College in Chennai. The thing is, we were the first NEET batch. 2016, the first NEET exams were enrolled, and my choice of college was not something that I would have that fell right into me, but that was my only option. In 2016, when NEET was being implemented, the TN government had a stay on government medical colleges. They wanted to admit students through the previous method that was already prevalent by the cutoff scores. So we weren't allowed to register in government colleges. So our only options were deemed in private colleges, through which NEET was only implemented in that year. So in that, I picked the best university, which is Ramchandra Medical College, because of the patient flow that they get, because of the teaching that they offer, and the academic response that I got from the people that are already studying there and the alumni there. And for you guys, I'd say a government a government college and a government hospital would be the best choice right now, because once after you finish NEET, that is where the most amount of cases, the most patient footfall, and everything would be there. Academia there, I'm not really sure about how it changes in different colleges, but medicine, I'd say, is mostly a soul left. There will be teachers that will be taking classes, but it'll be mostly learning from the patients, and and the hospitals and the institutions with most patient footfall would be the ideal choice, I'd say.
Okay, now we have a question from uh, Sairam. What is it like to be an MBBS student? Is it really hard to be a doctor?
Well, it depends. There are phases in life where you question your choices, and there will be phases in life where you're uh, why are we doing a course that is this long and strenuous? But I'd say the benefits from it and the things that you obtain from it are a lot different. And doing throughout your MBBS course, uh, you'll be having a lot of you'll be having very limited uh, I'd say very limited time for yourself. You'd be having to focus more on catching up with the course that's happening, being up to date with what's been happening. And medicine is a very evolving field. Like, every day, everything changes. Like, what was the definition and the treatment for diabetes 10 years back is not the same now. We have more aggressive ways of diagnosing. We have more aggressive ways of treating, more aggressive ways of testing and treating the patient. So you'll have to stay updated. And when you take medicine as a career, you'll have to be studying for a longer time, but that studying won't be a burden as such. When you finish your basics, when you finish MBBS, and then you build upon when you go for your postgrad degree, uh, studying will be something that you'll be interested to do. You'll want to become a better diagnostician, you'll want to become a better physician, and those are the things that will make sure that you go forth with it. And I'd say MBBS, you also get a you it depends on how you manage your time and how you play around with it. If you have a very good scheduling that you can do, that you can focus just an hour a day on studying during your exam times, it'll be a lot better. Focusing an hour or two a day is more than enough, and you can spend the rest of that time doing your activities and everything. I won't say it's a very rigorous or it's a very chill kind of it all depends on how you manage your time.
There's another question from Nakshatra. Is
Yeah.
it like a regular 9 to 5 job or do you have random schedules based on your patients or projects?
That yeah. My course is my course would be a regular 9 to 5 job. Like when you take medicine or when you take surgery as such, you won't know when the call will be coming. When you're doing after MBBS, when you're pursuing MD general medicine, I'd say, when you're on call, there'll be times when you're on call. There would be a patient that'll be coming in a different time, and you'll have an erratic work schedule. And India's has a very we don't have that enough doctor per patient ratio in India yet. Like for every thousand for every thousand people, there needs to be one doctor. That is the ideal ratio that WHO recommends, and we have not met it yet. So we will obviously be a bit overworked, and the schedule would be haphazard. With my field, like what I have chosen, PSM or community medicine, it usually is a 9 to 5 job.
I have one question about medical specializations.
Yeah.
Uh, there are some fields in medicine where you pick a very specific niche category and you spend a lot of time working on it. However, there are times when there are some innovations that completely change that field or make it unnecessary. So, how does how do doctors cope up with that?
Yeah. I'd say there are the thing is some aspects of that question is right, but there are some aspects that is not right about that assumption, I'd say. For example, let's take radiology as a field. Radiology, after you finish your MBBS, you are a physician, and then you take radiology. Your job becomes only focusing on you only look at black and white films of CTs, MRIs, X-rays, and everything. AI has involved seeped into this field, and AI diagnostics tools are being used. They are used to detect abnormalities in your X-rays, in your CTs, and in your MRIs as such. I'd say rather than it replacing your job, it becomes another skill set that you have to gain. Using the AI tool that's available, a good radiologist would be able to exploit that tool and would be able to use that tool to their job as a liking. You will be competing with radiologists that are able to use that tool and that are not able to use that tool. You wouldn't be competing with that tool as such as in person, because at the end of the day, a diagnosis and a confirmation requires a human thinking brain. And artificial intelligence can evolve to a point where it can almost have a very high sensitivity, and specificity is like how good is it to diagnose a disease, how correct it is, how right it is. That's what I'm talking by that term, sensitivity and specificity. A sensitivity and specificity of a human who is well trained in that field, who is looking at it, is the gold mark and the bench that we aim for. And AI has not reached that benchmark yet, and all the tools that are being developed right now will be around it. So every a good radiologist would be able to use that tool that's available and incorporate it into their profession and career practice, and they'll be able to exploit it. There wouldn't be a niche category that would be completely replaced in this particular field. Like there's not like one single aspect of it that is completely replaceable. And the other thing would be robotic surgery. There are robotic arms that can suture better than a surgeon, that have the precision and everything, but it needs close monitoring and someone has to operate it. And the more you learn about it, you get well versed in it. When laparoscopy came into play, earlier surgeries in the abdomen, you'll have to open the entire abdomen and you'll have to operate and you'll have to put it back. If someone would have undergone an appendicitis, they would have just small incision ports in their body. The scars will be minimal. There, the laparoscopic instruments were used, where a camera is inserted, where other instruments are inserted, and with use of those instruments, you perform the surgery. Surgeons who adopted the laparoscopic surgery format excelled a lot more than the surgeons who were not willing to adopt it. So it's all tools that make our life easier. So there's no particular replacement of a niche category that you go through.
Okay, that was really insightful. We have another question from Saira. Is it possible to study for NEET without going to a coaching center?
Well, that's a good question. See, the thing is, our coaching centers or coaching. Do you guys have like we when we were there, we had uh, I'm not sure about the name yet. They It was inculcated into our coaching in 11th and 12th. Uh, I forgot the name of it. It was a coaching institute that had inculcated itself for the students to train them for the certain exams and tests. And that was a foundation program that we had joined, and we had an option to opt for Master G. Yeah, Master G was there, and it was there for us along with their staff also used to teach us. See, the thing about competitive exams like NEET and IIT or IIT JEE entrance exams is that the questions you see and the options that are given are a little bit different, and your traditional method of learning would see the CBSE as a syllabus was a very when I moved into CS Academy, I had to leave the state board syllabus and switch to the CBSE syllabus, and that syllabus was very useful for me to have a good understanding of the particular knowledge, as it didn't focus mostly on rote memory and learning. It focused more on application and problem solving, and that helped me through my 11th and 12th. And I also was enrolled in the foundation program, where they helped me to navigate how questions are asked and how to approach those questions and how to answer it. I'd say the ideal thing that everyone should be offered is a common coaching for every student that there is available, and the platform is even, but that is something that has not been achieved yet. So it's I would still suggest that you go forth with a coaching center where they have teachers that are well versed about the questions, well versed about how the questions are asked, how the answers are given, which subjects are given importance, and which aspect of those you'll have to learn. So for that extra edge that you will have to push your scores beyond that, I'd say you have to your CBSE and the syllabus is sufficient, but along with that, that will give you an extra edge for you to tackle those competitive exams. Yeah. Okay, I can see one question here. Have you interacted with doctors around the global group through conferences or any kind of meetings, and how different is the world of health outside? Yeah, I have. We. The thing is, when you work in public health, you have this opportunity to interact with other doctors from different countries, from developing and developing nations. I would like to. I don't know if I'm taking a lot of time. Is that time? Can I take 5 minutes? Is that fine?
Sure.
Yeah. So this one experience I'd say is about HIV as a disease. PLHIV. That's how we call people that are diagnosed with HIV as people living with HIV. That's the proper and apt term that you'll have to use for. And the treatment of PLHIV is different in different countries. Like when you take it, when this PLHIV, it's a sexually transmitted disease, and not just that, it is also a parent to child transmittable disease. If a parent has HIV, that disease can be transmitted to the child. So the main the how it spreads in the community is mostly right now is by PPT, parent to child transmission, and we prevent it. Prevention of parent to child transmission. We call it PPTCT, and every country has a different approach towards it. When pregnant mothers are being diagnosed with PLHIV, they are started on antiretroviral drugs. So HIV is a viral infection, and you have to give antiviral drugs for it to be controlled, and they can lead a normal life throughout. So pregnant mothers are given these retroviral therapy, and when the child is born in US, the medical reality and the guidelines that they follow is that that child should not be breastfed by the mother, because the probability of that if the child is not having the disease, the probability of the child contracting the disease from the breast milk is higher. So they completely stop the breastfeeding of the child right as it is born, and they switch to formula feeds and uh, other express breast milk from donors. That's how they switch to it. They can afford it. But in India, the thing is, we advise strict exclusive breastfeeding for that children. In a country where there's unsafe water, the children are more prone to infections. The children are at a more risk of dying due to acute diarrheal diseases, due to use of unsafe water and due to use of other formula feeds. When you buy formula as such, you'll have to mix it with water and have it. In India, we don't have proper access to water in every place yet. So the guidelines in India is that we have to exclusively breastfeed the child during first 6 months. So it has that immunity, it has some amount of health, it has some amount of it has a better living edge to compared to other children with that disease, and that's how the guidelines differ. So when you interact with other doctors in this field, when you look at how they have a different policy and guidelines for treating it, we understand where we are as a nation, and we also have to focus on how we can improve it. And this gives us insights into how the guidelines can be changed, how management of certain diseases can be changed, how that treatment protocols can be changed, and how those can be adopted and adapted for our country, adopted and adapted accordingly how it's needed. Yeah.
Okay, thank you for that response. We will be having one final question before wrapping up the session. Thank you everyone for your active engagement. Dr. Pratheshwar, before we finish off for today, what advice would you give to students who are serious about medicine? When should they start thinking about it? How long should they prepare? And what should they truly understand about medicine as a degree and as a lifelong career? And for those who want to serve society but may not become doctors, what other meaningful paths exist?
Yeah. uh Now, the I like to when you have to get serious is, it's not something that you prepare yourself and say, this is the point in life that I have to get serious about everything. I'll have to keep away all my distractions, I'll have to keep away all my hobbies away. It shouldn't be like that. A path or career that you are choosing should involve and include your hobbies and your free time and your other leisurely activities and things that you have to focus on. But at the same time, with social media and other distractions that are commonly available, it's easy for us to get lost in that cycle of doom scrolling and consuming content that's not really needed for us, or spending a lot of time in other necessary stuff. I'd say consistency is one key factor. You, as early as ninth and 10th standard, you'll have to start focusing on understanding your basic principles of medicine and science. Biology, physics, and chemistry starts in ninth grade. Like till eighth grade, it's very easily understandable. And if someone tells us, it's easy for us to inculcate, and it is easy for us to just listen and write down in our paper. Like just 10 or 20 minutes, you listen to someone give out an answer and you can just reproduce it in the paper. But it's not like that right after ninth grade. Your core subjects, which is physics, chemistry, and biology, you have to focus it more on at this point of time, and you'll have to understand how the basics works. And when you have a grasp of how the basics works, then you can go forth with it. And for your entrance exam preparations, which is about NEET PG, for that preparation, you should ideally start from your 11th standard. Um, the It's not like the public exams also matter, the at the end of the 12th, the board exams, but both the 11th and the 12th, those two set of years, all the things that you have studied throughout those 2 years will be what will be asked in your entrance exams. So spend some amount of time for your normal school related homeworks and all that, and spend an extra hour preparing for these in every day, so that you don't have to sit in the last minute and have a final dash of study towards it. So I'd say will be one advice for you guys to start getting thinking about medicine as a career and how to go forth with it. And with working hours and everything, it is a challenging field, and it may vary upon what specialty that you are choosing. But once you get into medicine, you'll have the option of choosing which career that you can specialize in, which post graduation that you can pick, and what kind of lifestyle you can have. Just because you're taking medicine now doesn't mean that you'll have to spend your entire life with different improper working hours, different on night calls and everything. You have a wide variety of options even after choosing medicine. Your career options are still you have a lot of wide options to choose from. So yeah. And yeah, one more thing. If you want to serve the public and if you want to help, MBBS is not the only, or being a doctor is not the only way. Every profession, you will have to interact with people. You will have an option to change their lives in a different way. When you become a lawyer, you understand the problems of the people. You go to court for them. You file complaints and litigations for them. Every career has its own way of impacting the health. I'd say you stick to being humble. You stick to having empathy towards people. You strive for a society where all the inequalities are removed, and where everyone has proper access to every basic needs that are necessary for life. Every career you choose will impact people in a different way, and It's not this as such, and there are various other options. If you choose PCMB, not just becoming a doctor, you can directly go for a public health course, and you can directly work in public health as such. Or there are other ways like biomedical sciences. If you're interested more about lab work, research, and how other intricate things work, there's marine biology that you can focus on. There's environmental sciences you can focus on. There are a wide variety of opportunities if you take up a certain course. Just because you're taking PCMB in the next 11 for 11th and 12th doesn't mean that your field is towards a doctor or an engineer uh, or anything in that field. Like, you'll have a wide variety of options. Keep talking to people, keep interacting with people that are in different certain jobs. Find what you're passionate about, and yeah, main thing is keep talking to find people that are they will be very interested in letting you know how their life is, how work is for them, how what are the things that they go through. And yeah, just keep following people people's profession that you're interested in, and find every other way to talk to them about it. And that's the advice I'd give.
All right. Thank you so much for this grounding advice for students at every stage. Doctor, thank you for taking us through your journey so honestly and thoughtfully.
The story shows us how medicine can heal individuals and how public health can create impact at the levels of entire communities.
Thank you once again, and thank you everyone for joining us for this CS Alumni Talk episode of Voices of CS.